Sunday, December 13th, and I'm doing an updated video journal from my visit with the neurosurgeon on Thursday. It's a very interesting visit, to say the least. First, I spent about half an hour with the physician assistant. She's very great, very thorough with the exam. She asked me several questions regarding my pain, where I experienced the pain or tingling from head to toe. So I gave her, as we went through the list of questions she had, I did the best of my knowledge at that moment of where I experienced my pain and trying to describe it the best that I could. It just didn't seem like I was getting it across to her when I actually feel that I'm in pain. So I was having a little difficulty doing it where I could convince her that my pain is in fact true and help them get a better diagnosis to determine if I need the surgery. So after we did that, Dr. Wright comes in, and after looking over my MRI film, which went back from just recently, 6 months ago, to 2 years ago. Yes, 2 years ago, July 18th, when I had the surgery here that I talk about often. I also explained the injury to my back. My back hurts worse than my neck. It feels as if someone is taking a bat and beating me constantly in my back. Regardless of where, if I'm sitting, standing, bending over, squatting, doing my yoga, it constantly feels as if someone is hitting me in my back with a bat. And then I have these short pains where it feels like there's needles being stabbed throughout my body, the rest of my body. So I was trying to explain this to them as sufficient as possible to help them help me. So, like I said, Dr. Wright comes in and he, after going over my film and comparing me my symptoms, he said that I wouldn't be a candidate for the surgery simply because I wouldn't have any relief. So the surgery would not give me any relief. So that concerned me, because if I'm not a candidate for surgery to correct the herniated disc and the problems that I have, then what is there? Basically, what is there is for me to continue taking narcotics and running my body until it kills me. However, they did offer me two things. I have two options to determine. They both were a day surgery. So they sent me home with some brochures and CDs to watch. The first one is the Neurostimulation therapy for chronic pain. This didn't come with a CD, but it came with some brochures. So what I did is I came on YouTube and I researched it, and there's some leads that they would put in your, like an epidural, or put in your spine, and the leads would go up. It'd be like 2 holes. Day surgery they would attach it to your spine, and you have these leads, and you have like a remote. And whenever you have these pains, you would hit the remote to stimulate your spine. So the leads would send like shocks through your spine that transmits to your brain, tells your brain you're not hurting anymore. And so I think it's the way it's described on YouTube. I think it's the same as a TENS machine. And if that's the case, TENS machine doesn't work for me. So this one would be out. But if there's anyone that's done a neurostimulation therapy, or know anyone who's done it, that's familiar with it, please leave me a video response or a comment telling me a little bit about it. Because I'm calling the doctor's office tomorrow to tell them what my decision is. The other option would be the drug delivery therapy. Now this one is a CD. This is for chronic pain, and it's inserted through the abdomen. And you also have a remote, and whenever you have the pain, the actual medication goes to the site where you have the pain, where you're experiencing the pain. Now this sounds more reasonable for me because my pain is so chronic that is at such a chronic level that I actually need, where I'm having the pain, for some type of medication or something to be able to stimulate that so I will no longer have pain. So this is the therapy I decided to go with, the drug delivery therapy. So if there's anyone that's doing this, let's have this done, this procedure. Again, please give me a video response or comment about this. But I think this is the way I'm going to go. For the simple fact, I don't think I can see leads being inserted and contacted on my spine. So I have a lot of what if, what if, what if. I have more what if questions for the neurostimulation therapy. And I'm concerned about leads being inserted in my body and wrapped around my spine. What if I'm standing in front of a microwave? Or I have problems when I go to the airport walking through the radar, the metal detectors. You know, are those leads going to corrode while they're in my body? What they call tumors. So I have a lot of concerns about this, more so than I have about the drug delivery therapy. So that's the story. I'm going to have one of these surgeries. I'm planning to call the doctor's office tomorrow to give them my decision, which is the drug delivery therapy. However, like I said, if there's anyone that's had either or, please give me a video response or a comment, because I need your help. As much information as possible, anyone can educate me on this, it would be greatly appreciated. Now, usually when I go to the doctor's office, they ask me what is my pain level. Usually it's always a 10, but sometimes I don't want them to think I'm exaggerating, so I'll go to level 8. But my pain level is always a plus 15. It is so painful living with this. And June 16th of this year, I was diagnosed also with having multiple sclerosis, MS, multiple sclerosis. But the doctors here in Texas doesn't think that I have it. I received a bill in the mail from my insurance company stating that I was admitted on June 16th, and it also shows that I had the testing. And it also shows from the insurance company that they sent an accurate medical documentation. So, which tells me that I was in fact diagnosed with multiple sclerosis, but the documentation is flying somewhere within the hospital. So, that concerns me, because this is my health that we're talking about, and they're losing documents. They're floating all around that could be hurting me, you know, later on down the road. Anyhow, that's the results from my appointment on Thursday with Dr. Wright in Temple, Texas, at the Scott and White Clinic. Thanks for watching. As always, God bless.